I'm Dr. Rob Green. I'm the Medical Director of the Nova Scotia Trauma Program, and I'd like to introduce you to the legal blood alcohol test. The legal blood alcohol test is something that we do in potentially intoxicated patients when they present to our trauma resuscitation room or an emergency department, and it's requested by the authorities or the police. We in the medical system see a disconnect between the number of intoxicated drivers that we see from alcohol use and abuse and the frequency of any legal repercussions whatsoever. We believe that an increase in police asking and us helping getting the legal blood alcohol sample for the police in the established protocol would vastly decrease the number of alcohol-impaired drivers on the road. And our research here in the Nova Scotia Trauma Program shows that only 11% of the time that an intoxicated driver will have any legal repercussion whatsoever. Getting this test done is as simple as asking the physician in charge of the patient to help with getting the legal blood alcohol. We're not going to say no.
Alcohol-related motor vehicle collisions are one of the most preventable causes of trauma that we see, so it's an important public health issue, and impaired driving is very infrequently a one-off or an isolated incident. But if this is a repeat pattern in a person's life, we want to catch them and intervene. We know that legal consequence for their action in combination with alcohol treatment programs is one of the most important things that we can do.
All hospitals in Nova Scotia can do a blood alcohol right now. So I could go into the department, take a blood sample from a patient and mark down that I wanted to get a blood alcohol level. The trouble with that is we never know for sure, did that blood sample absolutely legally guaranteed come from that patient? It's possible that the police or the Crown prosecutor can ask for blood results from the hospital, but those are often, that kind of argument often falls apart. So the legal blood alcohol process that we're talking about today is absolutely vital.
Our province, I'm speaking for the province of Nova Scotia, mandatory reporting exists for gunshot wounds. So if a patient comes into the department and they've been shot, we then can call the police to let them know. This does not exist in our province for alcohol-related impairment or driving injuries. So if a patient comes in and they've been in an alcohol-related crash, or we suspect they've been intoxicated in driving, it breaches patient confidentiality for us to call the police and report that.
So if I see someone in the department who I smell alcohol in their breath, or they even say, yeah, I had a few drinks and I crashed my car, I'm not able to call the police. That would be a breach of confidentiality.
We need the police there because the warrant for the collection, without that we can't initiate the process.
If we've identified quickly that our driver is impaired, forming our reasonable grounds, once we've done that, then we'll quickly look at the driver and decide whether or not they can provide a breath sample. If they can't, we don't feel that they're physically capable, that it's not practical to obtain that from them, then we'll read that blood demand. The blood demand is fairly straightforward. It lets them know that they will have to accompany us to a location that's suitable to obtain that, and that it will be done by a qualified medical practitioner. And also that they do have the right to refuse. However, they should be made aware that if they do refuse, they will be charged with the offense of refusal, which very often covers the same punishments as it would for failing a blood alcohol test.
So it has to be up to the police officer at the scene to have an index of suspicion that there's alcohol involved, in which case they then will trigger the process. They will come along, as I said earlier, with the patient, and will ask the patient through a legal blood demand to provide a sample of blood. They will either consent or not consent. If they consent, then I'm called in, or one of my colleagues is called in to perform the test.
It's a legally admissible piece of information requested by the Halifax Regional Police or the Town Police, the RCMP. So it's a blood test that we do. We do it for legal purposes, so it's collected in the incidence of intoxicated or impaired drivers, and then they use that in ongoing investigations or charges. In our department, we're fortunate to have a great working relationship with the police. We do collaborate often, and this is certainly a scenario where they are first responders. They're out in the community seeing all this trauma, and it's just as frustrating and as personally hurtful for them to respond to some of the scenes as, you know, when we see a loss of life or a completely preventable trauma come into our department. So it affects us all, and we are happy to work together, and that's exactly what we should be doing.
The purpose of today is to try and show that this is actually really easy, and we need to do it far more.
In terms of the process itself, it's multi-step, but not that difficult. To go through the whole process, it could take 15 to about 20 minutes. And ideally, we like to see the collection done within about 3 hours from the time of the crash or the accident. This part is very straightforward. It's straightforward phlebotomy for the samples, but there are a few labels and things and ways to seal this box that we'll go through. So this is your sample kit when you get it. It is sealed. I'm going to break the seal just with a pen I have here. So opening that up here, you have some additional instructions there if you need them. You have your vials themselves and your phlebotomy equipment that come in this kit. You have 2 safety seals and then 2 labels which will go over the vials. You also have an iodine swab. For obvious reasons, you don't want to be using an alcohol swab in your phlebotomy process, so we use iodine, and then a bag which will show you how to seal things in. So this is the box that contains our vials and phlebotomy equipment. This is also sealed. All right, so using my pen, I'm just going to break it down the sides here. And obviously, if they are broken when you encounter them, just throw it out and start again. You want to be using an unbroken box. This is what it'll look like when you open it. So inside this box, we have our phlebotomy equipment and our 2 vials, 2 empty vials. Next in the process will just be your straightforward phlebotomy. I've collected my 2 blood vials. The first thing I'm going to do is just mark on the vials, sample 1 and sample 2. Patient name, my name, the date, and the time. So I've done that on both of the vials here. Then the next thing I want to do is fill out the label I have that goes over top of the vial with patient name, my name, date and time. I'll do the same thing for the next label. Now, what we do with these is place these labels over top of your collected vial. And you want to do this in a way that doesn't obscure the label on the vial. So once I have both my tubes labeled with the seals over top, I'll just be placing them back into the box. On the box, there's some information called the police officer's report. This part is filled out by the officer who attends. The next step is sealing this box. That's done by either yourself or the officer, and it just says sealed by and the date. And there's a little area right on the box that says place seal here. So you have your sealed box, all your information. This goes inside the bag provided. So you have your box placed inside a bag, and then you just place it back into the box for the kit. And the last step is to take your additional seal and seal this whole box. So the same thing, I'm going to be the one sealing it, so I'll mark my name and the date. And seal it like that. And that's it. You are done. So once you've collected it, this goes with the police officer, the sealed the sealed box, and now you're ready to fill out some forms.
If you're an officer and you come onto a scene or you're sent to a scene of a motor vehicle crash, you speak to the drivers and you find that they are impaired. You meet your reasonable probable grounds and you find that they're impaired. You can arrest them for impaired driving at that point. You'll then need to make a determination of how you are then going to meet that standard, whether it's going to be from a breath sample or from obtaining a blood sample. If they're physically capable and able to provide a breath sample, that is going to be your first step. If not, and you've looked at it and you said it's not going to be practicable, or they're physically not capable of providing a breath sample, well, then you read them the blood demand. They're going to have to accompany you to a suitable location, which is going to be, in most cases here at the hospital where the medical staff are there. If that's the case, you may very well go along in the ambulance with them, because if you've determined that they're having difficulties medically, then that's most likely the route you're going to go. When you get there, you are going to have to inform medical staff that they are under arrest and that you've made a blood demand, and that you're going to need a blood sample kit to get a legal sample from them. They'll provide it to you, have a quick look at it, make sure it's not expired, that it's sealed and it's suitable for use. And then the medical staff will do the same. They're fairly familiar with that process. They'll then go through and through the instructions on the box are listed there for getting a proper sample. They'll give it back to you sealed, at which point in time you should make sure that you have also initialed the seals along with them so that you can verify those in court. Once you've got that sample from them, it's important, again, that you get them the proper paperwork as well, with the certificates of qualified practitioner and of a qualified technician, so that you can complete those forms, have them sign them, so that you can serve them upon the accused prior to the release. It's got to be done. Once you've got your paperwork from them and you have your blood sample, you're going to then need to take that paperwork back, place it into our evidence lockers, into the fridges, so that it can be maintained until we can get it to the forensic laboratory. You'll need to complete a C414. It's an RCMP form, because we're going to use the national laboratories who we use. Once you've completed that, you'll fax it off. You get an approval that they'll take that particular case and give you a case number. Your case number is forwarded to our quartermaster SOARs, who will then take our kits and forward them to the lab for analysis. That usually takes they usually set about a 90-day diary date on those for return on your analysis, at which point you'll get your blood samples returned to you, along with a report indicating what the technician has found within that sample.
So we'll walk through filling out the form. The first thing it's going to ask of me is to identify myself, and then identify the patient and the method of blood draw, so whether it's pursuant to a warrant or with the consent of the person. Then the next section will be outlining the information about the date, the time it was collected, the place it was collected, and then that you state that you received the samples from the aforementioned person, place them directly into the approved containers, and then we repeat the information that we marked down onto the vial. So again, the sample number, the date and time, the person's identity. If you marked anything else identifying, say your initials, then you include that on the form. And then the end is your certification. So you make sure you sign it, you date it, and that's it. So then the next two forms are if you're getting someone else to do the blood draw for you, like a nurse or a paramedic. One is a form stating that I have requested X individual complete the blood draw. The method of blood draw, so whether it's pursuant to a warrant or with the consent of the person, sign it, you date it. The second form contains identical information to the part we just went through, so stating who the patient is, what the sample vials are labeled as, and the date, time, all that information. You'll find less frequently are these two used, because often
other healthcare professionals don't want to go through this process, or they don't want to be called to court. And as physicians, it is our duty to be going through this. So often, as physicians, we do the phlebotomy and we fill out the first form.
There are little bits of things that we take home at the end of every day, and for me, this is definitely one of them. You know, when you see people who've been hurt and or have died, and it's completely preventable, and it's frustrating, and to know sometimes that for whatever reason, the drivers can be the ones who are least injured. So having fatalities in the car and the driver walks away, like, that is not uncommon. We see that. And when it comes into the department, it's almost like the whole department grinds to a halt, right? Because you don't just have patients, you have patients' families, and you have profound loss. And it affects us all. It affects our ability to go and provide, you know, excellent care to the next patient, because we hurt. It hurts. Like, it's not easy to see. And so if we can do anything to prevent, you know, one additional injury, it would be worth it.
It's difficult for the healthcare team knowing that the intoxicated driver that has caused a major crash will unlikely have any legal repercussion whatsoever. It's almost as if the medical system is protective of intoxicated drivers to some extent, because we're not getting this legal blood alcohol test done in a high number of patients. We know that alcohol is associated with trauma, so the more people drink, the more trauma there is. We also know that if you are intoxicated and have a trauma, about 40% of the time, you're going to have a second trauma. If we intervene at the first intoxicated driving incident and we change behavior, whether it be through legal repercussions or whatever, then it can only build to a safer province, less trauma, less victims of intoxicated drivers. The protocols are already established. We're not using them. We need to work with the police to ensure that this is being done, that the process in place, we're just following it. If we do it more, it may show us some really surprising and excellent results of decreasing intoxicated driving in Nova Scotia.